Welcome to the Black Doctor Collective podcast. We as Black doctors are in a unique position. We can change our communities, healthcare, and the world. Of course, we start by changing the way we see and value ourselves. I'm your host, Dr. Shanika Horn, pediatrician and physician coach, travel extraordinaire. I am so happy to have you here and listening. So let's get into it. Perfect. Okay, welcome back to the Black Doctor Collective podcast. Today we have a guest episode. These are my favorite. And we have Dr. Moulton-Levy, who is a board certified physician with almost 20 years of experience and a newly barred attorney, because one thing Black women are going to do is it all. Throughout her practice, Dr. Moulton-Levy has experienced inequities in medicine firsthand, and patients seek her out specifically because they have faced discrimination elsewhere. So in the early days of COVID, right, in the pandemic, she volunteered at a hospital caring for COVID patients, which really shed new light on the realities of medical inequality and medical racism as a low-income Black or Brown patient. They were denied access to ventilators, right? Their lives were valued less than others. So while her medical practice has allowed her to engage in problems of inequity on an individual patient basis, she witnessed how medical and legal barriers intertwine to systematically deny care to certain groups of people. So in 2021, she reached a point in her career where she decided to go to law school to address these issues on a more systemic scale. Because of the structural dimension of medical inequity, a law degree enables her to take an intersectional approach to addressing the legal aspects of the healthcare system in the United States and to better advocate for those whose voices are not being heard. Creating HJI, which we'll talk about, is her way of fighting for the New York she believes in, where everyone's lives hold equal value and everyone receives the physical, mental, and gender affirming healthcare they deserve. So, welcome.
Thank you.
That is so dope, first of all, because as a I will never go to school again person, I totally am like always impressed by people who are like, yeah, you know what? I'm going to do what it takes to execute a certain result. So I guess just share your journey and like what even made you reach that point. Like we talked about it a little in the intro, but I feel like there's more nuts and bolts to this decision.
Sure. So like many of us, I went into medicine because I wanted to help people. And that's, I'm a dermatologist and I do help people. I help a lot of people, but I've been practicing for almost 20 years. I've been very happy in my practice for 20 years. But when the pandemic hit, I think any of us who were in New York, you saw it. They were asking for doctors to come in and care, the dermatologists on the floors. But it was so dire a situation that they just asked anybody to come. So I volunteered.
Yeah.
And when I volunteered, the first day I came home and I told my kids, I said, every single one of I think there were 21 patients on my service, every single one was Black or Brown.
Yep.
It didn't make a lot of sense to me. And it really got my mind going about what's happening in medicine and why are the COVID hospitals looking like this? And then in addition, we all had our masks on, and I heard people talking about sometimes they would have these secret ways of saying, we'd like to give the ventilators to people who contribute more to society or to people who I even heard one person say, we don't put Black people on ventilators. I was shocked. I was shocked. I was shocked. And so,
Girl, what? I mean, first of all, you remember the maybe 30 years of time where people were embarrassed to be racist? When did that end? Because that's clearly over, right? Like people are just out here saying anything.
I think it was, I realized reflecting back, because we were all covered in masks and hats and gowns and everything, nobody could see me. And so I think I was led into conversations that I've never been led into before as a Black physician.
Yeah.
After the months of my being there, I thought, okay, I need to do something a little bit more. And I sort of racked my brain about what I could possibly do. And it just came to, I realized that there are two aspects of medical inequity, right? It's just the medical part of it, which is actually, I think, difficult to fix, and we're all working toward fixing it. But then I realized that there's a legal aspect to it. And the legal aspect is actually a little bit easier because there are clear legal rules
Yeah.
that I can use now that I know the law to try to address health equity in that way. And so I decided to go back to law school. And now I'm a newly barred attorney and I'm doing the work. And I went to law school with the sole purpose of starting a health justice initiative, or HJI. And now I'm doing it. And, you said you're not somebody who would want to go back to school. I didn't think I was either, but I don't know if this has happened to you, but where you have I couldn't say no to this.
Yeah.
The calling was pulling me so much that there was no way I could do anything else.
Yeah. Yeah. Obviously, I say that with some facetiousness. I think, like, really, all of us, for the most part, are willing to do what it takes to get a certain result, right? And so if going to school is the vehicle for that, then I don't know a physician who, like, especially I think as Black physicians, like, we are already doing so much to try to fix a lot of the gaps and to address inequities because those are our communities. I don't know anybody that wouldn't be willing to, like, do what they needed to do to get it done. So yeah, kudos to you for that. All we can do is take a little bite of the puzzle, right? Just what's our piece of the puzzle? What can we do? And I feel like that's a huge piece. When you think about the legal aspects, what do you feel like is your primary focus?
I've just started. I literally became barred like 2 or 3 weeks ago. And so so HJI has three different prongs. The first prong is direct legal services. So until 2 or 3 weeks ago, I couldn't do that. I'm now starting to collect cases. And basically, people come to me when they're having barriers to healthcare and they need some legal help. I'm working particularly and specifically with people who are experiencing poverty or who have low to moderate income. So the sort of cases I'm seeing so far are medical debt, refusal of coverage for procedures,
Mm.
discrimination with their doctors, things of this nature. So that is the direct legal services part. Secondly, I'm doing community outreach and I'm working with communities. So my pilot project, which is what's happening right now, it's been from May and it will go through the end of next year. The community aspect of it is I'm starting my pilot project in Brownsville and East New York. They're two medically underserved areas in Brooklyn, and they also have the highest rates of chronic illness.
Mm.
And so I've been going to the communities evenings and weekends, and I do events and I do talks, and I just try to educate people about healthcare rights.
Yeah.
This is something that people don't know about. And I sometimes think the healthcare system wants us not to know about
Oh,
it. They try to make
I think,
so,
honestly, I think America's catered that way, right? Like the education system, we learn nothing about our own bodies or about nutrition or about even how to do taxes. Like, we learn nothing actually pertinent for adulthood in the education system. I think that's purposeful, right? I think healthcare is built on the same premise. So I'm with you.
absolutely. So that is the second aspect of what I'm doing. And as a part of that, I'm trying to, because the nonprofit is new, I'm the only lawyer. A big part of what I'd like to do is have healthcare advocates. So people within the communities who are able to help their neighbors, if it's just finding where the form is or helping them fill it out or going to a doctor's appointment. So there's a second set of ears. This is the sort of work that I'm doing in the second prong. The
Yeah.
third prong is policy work. I have right now somebody, NPH, who worked at the CDC. She's working with me now to do a community needs assessment. Once I figure out, working with the community and through her needs assessment, once I figure out what the true policy issues are, then I'm going to start to address them.
Yeah. Oh, those are like fantastic prompts, right? Like those, I feel like those are just like the hard hitting, this is immediately we needs, like these are immediate needs. This is what has to be done right now for people not to continue to suffer, like you said, with all these like high rates of like chronic illness and just not being able to navigate the system. Yeah. Oh, this is powerful.
Thank you.
Oh my goodness, this is so good. Okay. COVID, I feel like there's maybe an inkling before COVID. Like, what I guess was your work experience? Obviously, right? Because being Black in healthcare, it's like part of our daily observation. But what was your experience like pre-pandemic that you felt was already leading you on this path?
I'm in medical school and residency. I was working in hospitals, and look, we've all seen not only the patients experiencing racism, but the doctors ourselves.
Yeah.
There's so much racism in medicine. And I'm fortunate enough that for the last 10, 10 years, I've had my own practice. And if I have hints of racism in my practice, I address that. And so I've been able to curate this practice that works for me and is filled with amazing patients of all different colors and really respectful patients. And so I've loved my career in the last 10 years, but that's because I've been living in this little bubble.
Yeah.
So for me to get thrown back into a hospital where, yes, I've always known this is the case, but I think people in medicine know that COVID really exposed a level of medical racism that it was there, but not with the numbers and not with the same sort of impact. And my bubble was popped. My bubble was popped, and it reminded me. Yes, things I knew, but the scale was very different. And I just felt so moved. I just felt moved to do something about that in a different way than I have done in the past.
Yeah, for sure. I also think like in med school and in residency, like we see racism, but we're not in the position of power to do anything about it.
Correct.
And I almost feel like that first part of your career where you're like, I built this safe space is almost like the healing you need to go through after you've left institutional or academic medicine where you like had zero control and could not actually change the things.
That's beautifully put.
Yeah.
That's exactly it.
Yeah.
Exactly.
I think, a lot of people, because a lot of people who I think listen to this podcast are probably early career. So they're
Mhm.
just coming out of those places and those systems. And I think we're actively seeing now, I feel like I'm in a lot of Facebook groups with other Black physicians where people are talking about like how they're being targeted by their programs or isolated and you see the advice ranging, but a lot of it is like, keep your head down, like just try to get through it, don't do too much. So also like you have to outshine and you have to like you are visible, like there's no way to be invisible, right? Like you have to, so it's like these you have to keep your head down but also be amazing and you have to be all these things to everyone so that when you do get out you will have one or two things. You're either in a space of I need to create a bubble for myself, or you're like
Right.
so indoctrinated into what they've told you that you just keep trying to prove yourself indefinitely until you burn out.
Right.
Yeah.
Right.
It's very fascinating, I think, like the impact of racism in medicine because it's all like negative. Like there is no positive. I don't understand why we keep upholding the system. I don't know. Like my constant question to myself as a physician observing racism in the world and in medicine is it better to stay in medicine or try to fix it from the outside? Right? If I stay, am I upholding the system as it is, right? Trying to patch. Or is it better if I were to totally rebuke the system and try to take this external approach? So, like, what's your opinion on what path you've chosen?
I have chosen to stay in it. I'm still practicing throughout law school. I practice throughout my new legal career. I'm going to continue my medical practice. When patients come to see me, especially patients of color, they want somebody who looks like them. They want somebody who cares for them. If we all leave,
Yeah.
people will be stuck with. I also think that there is a sort of power of being in it because medicine changes over time. And when you step away from it, you don't see all the changes that are happening within it. And I believe that there's a lot more power with knowledge.
Mm.
And I'm not going to step away, but I do understand the desire to, and then even need to for some people. And I don't fault anybody for whichever choice they make. This is a hard thing to stay in, but I will choose to stay in it.
Yeah. I love that response of what being there for the patient population too, right? Like they need, they just need that kind of care. My favorite journal article ever, I think it's New England Journal of Medicine. I always, yeah, but it talks about that a single Black physician in a county increases the lifespan of all the constituents in that county, even the patients they do not see. And so it's like that kind of impact is part of, for me, also the fuel to stay in it and work from within. I almost feel like yours is like a two-pronged approach though, right? Like you're in it and you're practicing and you're like, I feel like you figured out like the way to do both.
Yeah. Yes, that's a lot. I work all the time, and I wouldn't expect most people to do this, but I have figured out a way to do both. And I think at some point I'll probably pull back some medicine a little bit, but 2% of dermatologists are Black. 2%.
Yeah.
I'd like to keep that number up. And as we all know, with the current administration, we'll see if that number stays at 2 or if it goes down. I have found a way to do both, and I feel so, so lucky to be able to do that.
Yeah. Yeah. That's it, right? Like at the end of it, you just are making choices every day to preserve yourself, but also preserve your mission. What do you think is important? And whenever I think about all the doctors that are trying new things, that are like exploring these pathways, we're all literally solving for the same problem, but just from so many different angles. And that I think does eventually shift the tide, right? If we're all just like attacking this thing, this one beast from so many places, then maybe we'll actually make a difference, make a dent. I think like my own approach is like is retention in medicine, right? I can teach doctors how to create a career that feels meaningful and where they feel valued and they get to practice the way that they want to. Like they get to build, it's almost like what you said, like building the bubble, right? Like they get to build this protective layer. Then the work they get to do, like the room to explore these other options now exists. And they still get to serve the communities who really need them. So it's like, I think we're all literally just trying to do that same, trying to find that same pathway of like balance. So if you are doing both things and you're like working all the time, do you feel burnt out? Do you feel exhausted? What, I guess, where are you?
I feel burned out. I don't feel exhausted. I think after this long of being in medicine, you touched on burnout earlier. I realized very early in my medical career that I have to come first. And
Mm,
my mental health, my physical health, my everything, I have to come first. If I'm not showing up as the full me, I'm not actually showing up for my patients.
yeah.
There were times during law school where I had to take a step back, whether it was from school or from work, and everything sort of gets out eventually. But I know that I come first.
Yeah.
I don't feel that now.
Yeah. If you had to advise people, because I'm like, you are a doctor, you're a lawyer, you're a mom, you have a lot of roles and a lot of like interests, right? What does balance look like to you? Like, what does that look like to you to put yourself first in terms of timing or efforts? Like,
So I went to law school and my children were out of the house. My kids are 22 and 24 at this point, and they both just moved back into the house. But when I was in school, they weren't there. Now that they're home for the summer, I'll take evenings off working, or sometimes they'll come with me when I do tabling events in Brooklyn. They'll come with me and join me. And in fact, when they were both pre-med before, and when I started law school, they saw how much I enjoyed it. They're both going to law school now. But I have hobbies. I sing, I listen to music. I find time for myself. What I've learned is being older and being in school, I'm just better at prioritizing and I'm better at efficiency. And yes, balance. I balance.
I feel like that's like a needed perspective to hear though, right? I feel like there's a lot of people who doubt themselves when they're older and they're like, oh, to go back to school, I don't know if I can do it. I don't have the same like vigor that I had when I was young, but like they don't account for like maturation. Yeah. That's a good perspective. For anyone who's listening who's like doubting, should I do the thing? Yeah.
Yes, the answer is yes.
The answer is yes. This is it. Do the thing. I love that. Awesome. Okay. So you are finding this balance, like you're creating this path for yourself, and you're able to do it because you know how to self prioritize, right? Like you know how to pretty much use your values as like this guide. That's what it sounds like, right? Like you're literally letting the things that you value, the things that are important to you, guide your journey.
Correct.
How do you know it's the right thing?
You don't.
Listen, doctors are formulaic. We want to know it's the right thing to do. We want to follow the right steps.
You make mistakes on the way. You make mistakes and then you fix them. And sometimes I notice them, sometimes other people notice them. Sometimes things just don't feel right and there's nothing to actually notice as well. But it's self-correction and also having a great group of people around me who are supportive but direct and honest with me.
Yeah.
Is it the right thing? I used to have imposter syndrome in medicine. I have so much imposter syndrome now in law. The medicine has trickled away and I don't feel it as often, but it's nonstop. I wake up and I'm like, what am I doing? What am I doing? Is this a good idea?
Yeah.
But when I sit with it and really think about it, and when I'm in the communities of people and they're so appreciative because healthcare, legally, it's not a right, but it's a basic human need. And when people can't get it, or if people have issues that have in a hospital or a doctor's office, I know that helping them is the right thing. I know that.
Yeah. What would you say is because it's so funny, right? Like I'm listening to you and I'm like, you're so accomplished. How could you have imposter syndrome? And someone will look at me and say the same thing, right? You've done this. How could you have it? And it's just so common that like doctors, no matter where they are, or like you'll have this layer of like doubt or moment of pause, or like, ooh, am I qualified to do the thing that people are allowing me to do? I guess what is your internal question when you're feeling like, "Ooh, what am I doing?" What is the like doubt that you hear or what's the thing? I want people to recognize that you are not the only one. And yeah.
It's when I was applying for law school at one of the schools that I got in, someone said, "You're going to be the grandmother of the class."
Wow.
I, I
Whoa.
I had a student in my class who just like she came over to me with her eyes down and she said, I'm sorry I haven't spoken to you, but in my culture we don't speak to elders. So I just felt so old and like I hadn't been in school in 25 years and can I really do this? And who am I kidding?
Mm,
It's that was my self-doubt. And I thought I'm older, my brain doesn't work how it used to. And then now that I've graduated, I clearly should have proven to myself that I can do it. But then I'm thinking, but what if I don't know how to lawyer? What if I don't know how to be a lawyer and I'm just messing up? There's so
mm,
negative talk that I do a really good job of letting that talk happen and then sitting with myself and saying, these thoughts, you can get rid of them now. But there's a lot of self-doubt.
yeah. Yeah. Oh, honestly, it feels very similar to being the only anything in a space, right? Like being the only woman in a space, being the only Black person in a space, being the only Black woman in a space, being the only, that's really feel, because once it's not reflected to you, like that you are the norm or like the status quo, then of course automatically you're like, am I supposed to be here? And then when other people are actively reflecting that to you, please, I don't need any help in this department. Please take your thoughts with you.
My law school, when I graduated from medical school, I was one of two Black people in my class.
Mhm.
I graduated from law school, there were a lot more, and that was hopeful.
Yeah.
But seeing these younger people of color who had, I guess I'm a little bit jaded, but I've been Black and in medicine for so long that it doesn't faze me anymore as far as wondering whether I belong. But
Mhm.
I saw all of these younger people in my class who were having these questions
Yeah.
and who would call me at night and say, "Oh my gosh, what am I doing? Does this make sense? I can't." The school and so I was there to actually be a mentor to them in that way with race-related questions that people were having. But there was a lot of self-doubt, especially among the Black people in my class.
Yeah. And do you feel like that was race-based, or do you feel like there were other things that contributed to people feeling like,
For the most part, it was race-based.
yeah, that's unfortunate. And another reason why we need to be in these spaces, because,
Yeah.
yeah. Oh my goodness.
My school, I think they tried, but actually they weren't successful in supporting the Black students specifically. And the Black students felt that.
Yeah. Yeah. What do you think would have made the difference? Not that you have to come up with the solution for racism in law school, but you know.
I don't know. That's a good question. Law, similar to medicine, is inherently racist.
True. Touche. Right? It's like the systemic
Like,
component of it. So what that would help. Oh my gosh. Yeah. No, it's just fascinating to hear because again, like at every level, people have imposter syndrome. And of course, there's like a variety of things that contribute to it and create that. But then it's what you do with it. So I love that you were like, I let the thoughts happen. And then I decide, okay, that's enough of that.
yes.
Yeah. So what's like your pep talk? What are your, okay, I hear all this. What's your like process?
It's like pep talk.
A shift, right? There has to be a shift. Like you can either decide these thoughts are true and I can't do the thing that I deeply desire, right? Because like I just can't. Or you're like, I hear that, but also I'm going to do it anyway, you know?
My process is I hear that, and I hear that that's an aspect of this whole need that is very complicated and has many different facets. And I hear that scare. Well, I guess my process keeps reminding myself that my self doubt is coming from fear.
Yeah.
Live in a space of fear. So I remind myself there's no need for fear. And that's how I get out of my head.
Yeah. No, that's good. Like even just recognizing that that emotion exists and being like, this is what this is, and I see it, and okay, it's there, but also there's other emotions and there's other parts of me that desire other results. So I'm gonna go with that. I think that's like a skill people learn, but only over time. I think that that's like you could potentially learn that younger, but I think just as a natural progression, it's what people talk about when they talk about like getting older. It's like you like the way you process things shifts, right? Where you're like, oh, this exists and it no longer runs my life. Yeah. Yeah. Oh, this is good. It's so fascinating. No, because people are going to listen and they're going to be like, I feel that. Like, I feel this way. And now what do I do? Because I do want a different result. You
I
know?
mean, and I said I'd listen to it and I hear it because that is part of me. And if you just try to cut it off and pretend it doesn't exist, it can come up even stronger in other ways. So I recognize that. And I think that's one of the most important things. Like all of these thoughts are part of me and they can all coexist. And
Mhm.
at the end of the day, I going to try to turn down the volume on the self-doubting part and up the volume on everything else.
Yeah. Oh, that's amazing, because that is everyone's first inclination is, oh, I hear this voice. I'm just going to shut it down. I'm just going to suppress it or ignore it. She just needs to like be quiet, you know? That's the first thing everyone wants to do.
Right. It might work for some people, but it doesn't work for me because
I don't think it actually works for anybody. I do think it's exactly what you said. I think it just rears up either somewhere else, or it rears up even stronger like later on. Yeah, that's good. Okay. So I think it's very easy to see why you were able to get through law school, pass your, like this whole thought process, right? Like, even though the doubt was there, this is how you process it. This is how you move through the space. This is what's going to allow you to keep showing up for the community. Like, I think that's the other component is like you have a purpose,
Yes.
and the purpose will outweigh the doubt.
Yes.
Yeah. What do you think gives you the biggest sense of fulfillment in like this new work that you're doing? What are the moments?
What gives me the most fulfillment is I'm learning so much from people.
Mm,
I'm learning, people have so much to give, so much knowledge and so much information. And I feel really, really humble. People share with me.
mhm,
Some rando person who's just telling me, I've been doing the work. I've been going and spending a lot of time with these people, and it took time for them to start to trust me. But
mhm.
that they're able to let me into their most vulnerable moments,
Yeah,
that means a lot.
yeah, yeah. It kind of reminds me of like when I did before med school, I did an MPH because I didn't know if I wanted to go to med school. I was trying to decide, like, can I do healthcare in a different way? Because med school looks long and daunting. So it was like, let me see what else is out here in like the public health realm. And I think like when I think about doing that degree, right? Like I took a lot of classes, obviously, but I think the parts that were the best parts were when I got to interact with the community, right? Those are the lessons that I actually kept. Those are things that like sustained in my mind. Like I'm in a community, these things are happening real time. They are the best people to describe what is happening and what they need, right?
Mhm.
I do think that that even shaped how I do medicine, right? It's
Mhm.
like all of these things are kind of symbiotic. If you're able to bond with people and like really hear them and see them, it changes the flavor of how you do everything.
And I think that extremely intentional about not going into these communities. They're not my communities. They're patients that I have live in these communities, and they were the one who advised me maybe to think about starting in Brownsville, East New York. So that's why these are not my community. And I forgot.
It's okay.
Just
Yeah, but like going into it with intentionality, right?
Oh, with intentionality. So I'm intentionally not saying, here I am, I'm a doctor, I'm a lawyer, I'm coming
Know everything.
and telling you what you need.
Yeah.
I intentionally inviting people to teach me and to help me and to tell me what they need and how, if and how I can be helpful. If they tell me you can't be helpful, I will leave. This isn't my show.
Yeah.
Yes, my intentionality.
Yeah. I connect to that very deeply, right? I feel like similar experiences like my MPH and like doing global health, it was all about going into communities and learning from them more than I think medicine really makes you feel like you are the expert. It's still as much as they try to tell us in med school, we're no longer paternalistic. They absolutely still are. And that was really what changed my view about being paternalistic was community work, like community-based intervention, bonding, listening, learning from people. I think those are always the best experiences. Yeah, I think it's really hard to be burnt out and like disconnected if you are looped in that way. Yeah.
Yes. I could happen if I didn't take care of myself.
Yes, of course.
I could, but I agree. I agree with you.
Yeah. I think it's like a well, yeah, like it's multifaceted. Like you have to do a lot of self-work and preservation, but then you also have to be grounded and realize like you can learn and you're always in a space of learning and a space of receiving. I think that is, yeah, those are all like really good when you're feeling burnt out, like re-examining. You're probably not doing one of these things, right? This is the checklist. You are probably missing a step somewhere. We like a checklist. We like to make sure we're hitting our milestones. Okay. No, I love this. Like I live in East New York and I'm like listening to you speak and I think like in my own like my mom bought a house out here. So it's a two-family house. She lives in one half, I live in the other half. And when we first even moved out here, I just remember feeling, oh, this is one of these neighborhoods where you don't see, you see a lot of groups of color. Like there's so much diversity actually in the neighborhood, except white people. Right. And that just has a different characteristic. But also, I can see the ways that like New York does not invest in these neighborhoods, right? And you can see when they start to invest, right? Because there's a lot of construction. Brooklyn is the most expensive borough right now, real estate wise, right? Because there's lots still room for expansion here, and there's still room to demolish things and build bigger things, which people love to do. But I'm just listening to you and I'm thinking about my own experience like in this neighborhood. And I'm like, sometimes I even feel disconnected from this neighborhood, right? Because I can leave and I do leave. Like I go to work every day or I travel a lot. And so like my own even connectedness to this neighborhood is very from a place of a lot of privilege, right? But as a homeowner, as a physician, as a and just yeah, I just now you have me reflecting about oh, I probably even need to connect more to my community. So I'm here for this. I love everything that you're doing. This is great.
One of my tabling events, I'm at
I absolutely would. Yes.
there's this beautiful farm in East New York,
Yeah.
and the community members come and they farm and they're so into their farming and it's gorgeous. And I go there often. I'll invite you one time.
Is actually last year that was one of the things that I was doing. They actually said East New York has the most community gardens in Brooklyn. And so I actually started to visit like a bunch of community gardens just because I was like, this is so crazy that I live here and I don't even know where any of these are. And then there was like all this fresh produce. And
Yes.
this is so crazy because from the outside, right? You're like, oh, this is like a poorer neighborhood or a not well invested neighborhood. But like the people here, I'm like, the culture is so rich and the people are invested in their own community. And if you look at it from the outside or let other people tell it, that is not the story they're sharing.
Because I find that people are, it's really a community and people are looking out for each other. The rest of the city is not.
Yeah.
And so they probably, unless you've been there, you wouldn't see that.
Yeah. Yeah. And there are a lot of community gardens over here.
I know.
A lot. They like literally have weekly farmers markets. Yeah. It's amazing. Okay, yeah, I'm definitely coming. You let me know the next time you're doing something fun, and I will absolutely come outside my house, even in this 90-degree weather.
We have an umbrella over our table.
Okay. They're like, there's some shade. I love it. Okay, so you're on this like amazing journey. You're doing this work. Where can people find out more information about like the work you're doing, or if they wanted to volunteer their time or participate in some way? Like, how could they do that?
So if somebody wants to just send an email and ask me a question, then email is the best. And the email address is info@health-justice.org. If somebody wants to volunteer or participate in some way, you can go to our website, which is health-justice.org. And there, if you want to sign up for a newsletter, we'll send out newsletters periodically just to update you about the progress and invite you to any events. And then lastly, if you want to follow us on social media, we're on Instagram, we're on Facebook, we're on LinkedIn, but right now Instagram is probably the most active one. So feel free to give us a follow.
Yeah, I love that. And we'll put all of the links in the show notes so that it's like easily accessible. People can just click on it. But this is it. Like, I honestly keep saying this over and over, especially now in this administration, this political climate. Community is what's going to save us.
Yes. Yes.
Like, the collective action of us as a people is what is going to, that's the only thing that's going to save us. Like, nobody's coming. Good
Yeah.
enough.
Yes.
So yeah, I think, anybody like just following just to even see like what's happening and being aware about the possibilities that can be done in a community and in our communities, I think that's going to be so powerful. I'm excited. I am definitely going to be, I want to see all the things and I will come and support. You just let me know. Thank you so much for listening. Please subscribe to the podcast. And what I want you to do next is link us everywhere you can. Instagram at The Black Doctor. Just become part of our collective. I want you here. Thanks. Until next time. Bye. But yes, I think everybody else, please follow, please support. And if you feel like I want to get connected, reach out. This is it. Anything else you want the audience to know?
No, thank you for listening. If you've made it this far, much appreciated.
Yes.
I look forward to seeing you at the farm.
Yes. We're farming this year. This is what it is. This is the way to go. I love it. Thank you so much for your time.
Oh my gosh, thank you so much for the invitation and for your time.
Yes, this was so fun. Okay, and we'll keep people updated too. So I will also share on my Instagram when I make it to the farm and when there's like a community event. So stay tuned. Things are in progress. I love it. Thanks, everyone. Have a great week. Thank you so much for listening. Please subscribe to the podcast. And what I want you to do next is link us everywhere you can. Instagram at The Black Doctor. Just become part of our collective. I want you here. Thanks. Until next time. Bye.